Hi, I'm Dr. Natalie Marks, and welcome back to another Quick Cup of Knowledge. Joining me today is Dr. Andy Hillier, Director of Dermatology Medical Strategy at Zoetis. Thanks so much for joining me today.
Great to be here. Thanks, Natalie.
You're very welcome. I want to jump right in because there's been a lot of advances in veterinary dermatology over the last few years, but one I think that's very important and unique, and one I know you're a very strong believer in, is the urgency of itch. Can you talk a little bit more about that?
Yeah, what happens when someone comes into a veterinary clinic with their dog that has itch? What do they say? Essentially, the discussion is, my dog's uncomfortable. I just want to get some relief. And that's kind of the conversation. And you understand what's happening. You say, well, where's the dog itching? What doesn't happen, you don't hear the emotional roller coaster that they've been on. They don't say, I'm frustrated, I'm worried, I'm concerned, I'm disappointed. I've tried 10 or 12 different things. It's just, my dog's uncomfortable, just can you stop it, dog? And if you heard all of those emotions, I think as a veterinarian, you might take a different attitude as to the urgency of the situation, okay? That's the first thing that I think we miss, because unless you're really good at questioning people and you've got a terrific close relationship, you don't hear that. The second part is, what do we ask? We want to know, where's the dog itching, right? And so we ask them, so where is your dog acting this behavior, this pruritus that you're describing? Well, the dog's licking at its feet. The dog's rubbing his face in the ground for an hour in the morning, and then it kind of dissipates. So as a veterinarian, as a clinician, my mind goes to its feet or its face. I'm thinking this is an atopic dog, or it's food allergic, and or maybe there's some facial fold. I need to do some cytology. My mind immediately goes there. It's impossible for me to put myself in their shoes at home in the morning whilst the dog's doing that and really understanding that experience and the impact of it. And, I think that if we could, we'd also once again say, my goodness, forget atopic dermatitis and facial fold pruritus. Give this dog some relief. So I think it's, and this is not an indictment of veterinarians, just the nature of what we hear and what we understand and being clinicians. So what I would love people to do is to think about every time someone calls with a dog that has itch, or they are seeing someone in a consulting room and the problem is itch, regard it as urgent every single time. I think it's important. And that will change your behavior in terms of how you're going to treat that dog. Because if you think something's urgent, what I would do, I'd grab an Apoquel tablet and give it in the room and I'd say, I hear you, I understand, this is really uncomfortable for you and your dog, and you do need some help. So I'm starting it right now so that by the time you get home, we can start to have some effect. Then we'll talk about some other things. And I think that'll be really helpful.
I agree with you, and I also want to jump back to what you said about the phone call, because I think that's a common misconception too, is it's so easy for us to just say, here's a phone fix, I guess we call it, right? And not see that patient. But that's really sort of a disservice both to the patient and the client, isn't it?
Yeah, and most of people are not phoning to come in. They're just saying, my dog's got itch, it's scratching. Have you got anything that I can do, okay? They're not saying, I want an appointment. And it's up to us to say, to reassure them that we understand what's happening and that we have some really great solutions in the clinic, but we need to see the dog. But, what happens is when we answer their request for advice. Well, you could try this, that, or the other, shampoos, some supplements, antihistamines, etc. And we miss the opportunity. Okay, and it's an enormous opportunity because they're already on that emotional roller coaster. And they've, by the time they call, they've already tried several things. If we just give them another simple thing that you could have found on Dr. Google or from the pet store clerk or something like that, that's not going to work. Then we know, as a veterinarian, as a veterinary practice, we know better than them. So why would they continue to trust us? Why would they want to come back again? We have that opportunity to actually, I always say to people, decide whether you want to delight them, get them in, give them the solution that they're looking for, or you're going to disappoint them by doing exactly what they could have found on Google.
And I think that leads into a little bit of the disappointment that I think a lot of our clients have been feeling when we prescribe or recommend an antihistamine.
Yeah.
So can you talk a little bit more about the misconceptions of antihistamine and treating that itch?
Well, I'm so pleased you asked, because this is a passion of mine.
And I don't know if we could do this in the time we have left, but let's try.
I'll keep it very simple.
Let's try.
When I speak now to veterinarians, I just say, if you walk out of here and you do nothing else, it's please never, ever dispense an antihistamine for allergic itch again, because they flat out do not work. And that's not just my opinion. I'm treated enough dogs in the past long ago with antihistamines to know that. It's the opinion of a group of experts that are on an international committee that provide guidelines. And you know where they put antihistamines? They put it in the bucket of medications that are likely to be of little to no benefit. Okay, I don't need to hear anymore. So it's, you know, and we've all had that experience. And what do we do when we do antihistamines? So here's 2 different antihistamines, because if the first one doesn't work, here's the second one. What we should say is the first one's not going to work. You're going to want to try the second one, which also isn't going to work. And 2 weeks' time, you're going to be back for a recheck, and nothing's going to be better. We can't fail people that way. We can't fail dogs that way. And we can't fail ourselves. We didn't go to vet school for 4 years to give something that we know doesn't work. So we just need to stop. Okay, I'm going to stop there.
Okay. So back off of the antihistamines, but it's a beautiful pearl for everyone to take from this. So for those new grads and students watching that are going to have an itchy dog that comes into their practice tomorrow, what is your best recommendation on where do you start? So
if you regard it as urgent, I really need to take action here that I know is going to work. There's going to be rapid relief of itch. That is why this person has taken the time out of their day to come and see me. Okay, you have 2 choices. It's Apoquel and it's steroids. They both are highly effective at reducing itch. They both work rapidly. That doesn't make them equal, okay? And the problem is that with steroids, we know from research that we've done that over half of patients with steroids have some short-term side effects. It's polydipsia, polyuria, polyphagia, behavior change. They pant in, they line in the corner, okay? So whilst you might take away the problem for which they were presented, the itch, you've now layered on 1, 2, 3, 4 other problems. Have you taken that person off of the emotional roller coaster? No, they're not relaxed. They don't have peace of mind. Now they've got other things that they have to worry about. Now I'm worried about my dog that I have to go home in the middle of the day to let it out, or I'm getting up in the middle of the night, or why does my dog want to snap at me when I go to take its food bowl because it's become food aggressive because of the behavior change associated with steroids. So there's a difference. Both work effectively at reducing itch. But what am I trying to do? I'm trying to meet the owner's needs. I just want my dog to be comfortable and me to have peace of mind. Giving steroids does not give them peace of mind because you run a significant risk of some of those side effects. And once we treat the itch, that also allows that client to trust in what we're doing, right? Because then that leads to a diagnostic workup, which is obviously the ultimate goal. Do you agree with that? And I love that you said that, because we shouldn't see this urgency and meeting the owner's needs, making the dog comfortable as the be-all and end-all. It's the priority, okay? But what we've got to do is by going into the owner's space and meeting their needs and saying, I hear what's happening. I'm going to fix that for you. That does give them a little trust. Man, that person understands what's going on here. So much so that they gave the tablet right there and then because they want this to be right as soon as possible. That generates some confidence in the veterinarian, a little bit of trust. And so what that translates to then is now they're a little bit open to, we need to undergo a diagnostic process, because at the end of the day, we really want to know why your dog's itching, okay? We can put a Band-Aid on. That's critical right now. Want everybody to be comfortable, okay? But at the end of the day, if we want a long-term solution, then there's a streamlined diagnostic process. And so we use that going into their space to get them to come into our space a little bit, which is best medicine, diagnostic workup, finding the right treatment for their dog. And you talked about Apoquel, you talked about steroids. Are there any other options for itch that some of our listeners can keep in the back of their mind for long-term control? Yeah, for allergic itch, I mean, at this stage of the game, you know, there's a Cytopoint as well, a product that we have. It's monoclonal antibody, which is just something out of this world in a way. Only one that's available in veterinary medicine. Of course, they're the mainstay of a lot of treatments in human medicine. They're kind of taking over in human medicine because they're so targeted and so specific, and they work so well if you know what your target is. And we know that dogs with allergic itch, there's the cytokine interleukin 31 that causes itch. Okay, and so what this monoclonal antibody Cytopoint does is it neutralizes interleukin 31. And it's a terrific alternative and option for us to provide tailored medicine and individualized care for pets and their owners. Because not everybody can give tablets. Apoquel is great, but it's a daily tablet, and you have to continue daily, okay? So if there's a need for some ongoing treatment, medium or long term, you want to be able to provide options. So there's Apoquel, it's a daily tablet, or there's actually an injection at Cytopoint. It's administered in the hospital, and it provides relief for 4 to 8 weeks. And when you tell that to someone, that's when you hear that, boy, I'm so pleased that you told me, because we've been using the Apoquel, love it, it works so well, but you know, by the time I get to the 3rd or 4th week, struggling to remember to do it, or my dog isn't so keen on wanting to have a tablet. So there's this alternative option, you know. So we're in a very fortunate place that we can really individualize care. Think about that patient, that owner. What's going to work for them? It's not one thing fits all, you know.
Yeah, and unfortunately, we have to wrap this up. We could talk about this, I think, for a very long time.
That's right.
But it's great to be able to give our viewers and listeners the newest options here as far as for itch control, but more importantly, a way to change their mindset and really taking notice and, like you said, taking an urgency about stopping that itch and understanding the client's perspective,
Yeah.
because I think that's so important.
Yeah.
Thanks so much for all that you do, and thank you for your time today, Dr.
Thanks,
Hillier.
Natalie. I enjoyed it. Thanks.